Hello and welcome to DD Nagaland. You are watching Top Form. There are 253 million adolescents in the age group of 10 to 19 years in India. This age group comprises of individuals in a transient phase of life. They are susceptible to several preventable and treatable health problems like early and unintended pregnancy, unsafe sex leading to STI, HIV, and AIDS, nutritional disorders like malnutrition, anemia, and overweight, alcohol, tobacco, and drug abuse, mental health concerns, and injuries and violence. School plays a critical role in helping students establish lifelong healthy behaviors. Recognizing the importance of these school-based health promotion activities have been incorporated as part of health and wellness component of Ayushman Bharat program. And we have none other than Dr. Tinurendra Anichari, Deputy Director, who will talk to us about school health and wellness programs. Doctor, welcome to the studio.
Thank you.
Doctor, let's start with what is Ayushman Bharat in school health and wellness program.
Okay. Actually, Ayushman Bharat School Health and Wellness Program is a joint initiative of the Department of Health of Education, School Education, and the Department of Health. So this jointly, it started from the ministry, the government of India, where they had a series of consultative meeting with the education department and the health department, and they came up with this program. So this program, it aims to improve the health and well-being of the school children. So what happens is during the year 2018, the operational guideline for the school and healthness program was launched by the then Prime Minister of India. And then in 2020, the Honorable Minister of Health and even School Education, they jointly launched this. The operation guideline was launched earlier, but now the implementation of this program was launched in 2020. So even in Nagaland, this was started in 2020, but you know, as you all know, like COVID started from 2020. So for 2 years, though it started, like not many things were going on. It was not functioning as well as it should. So only starting from last year, we are trying to implement this program like in a mission mode. And also we had a series of meeting with the school education department. And as per the guideline, the state level coordination committee should be with the school education, the health department, as well as the other allied departments like social welfare also, urban development, rural development, and in water and sanitation. All this together, we're supposed to constitute a committee, which we have already done, and we also had a series of meeting. And so like this Ayushman Bharat Health and Wellness, School Health and Wellness program was started.
I see. Why adolescents matter and what is the situation of adolescents' health?
Okay, adolescents really matter because when we talk about India as a whole, like 11% of all the total population in India, they consist of adolescents. And when we say adolescents, it's 10 years to 19 years. So this population, it comprises of 1/5 of the population. But even globally, also from some global studies, they've said that like 11% of all the population in the world are adolescents, but they spend only 1.6% of fund for adolescent health. So like they came together and said that it's adolescent because we have a good child health program, we have good maternal health program. So this adolescent part is the one which we are not paying so much of attention, and everyone has realized that these adolescents are really important. So now they are really giving importance to this adolescents, and so the school health and wellness program is initiated.
Would you like to tell us more about School Health and Wellness Initiative?
Okay, in the School Health and Wellness Initiative, the school ambassadors are chosen from each school. So one school should have one female and one male teachers who should be the school ambassadors of the particular school.
I see.
So every school that is under government schools. The school health ambassadors, one male and one female teachers are selected, and they undergo training. So this training is like age appropriate, skill oriented and theme based training, which the teachers are really trained, and when they go back to their schools, they are supposed to give this theme based awareness and health talk to the students.
I see.
And so that under this program, each health ambassadors, they choose 2 students, one boy and one girl, maybe the captain or the vice captain, who are known as the messengers, school health and wellness messengers. The teachers are the ambassadors, the students, the captain or the vice captain, like one male and one female, they are the school messengers, school health and wellness messengers. So these messengers are the ones who are helping the school ambassadors. And then we have these themes which are supposed to be used for the curriculum in the school.
Yeah, I read about the 11 themes.
11 themes.
Yeah, talk to us more on that.
This 11 themes, actually it's all about, number 1 is growing up healthy, and next is the emotional well-being and mental health. Then there is the interpersonal relationship, and then values and responsible citizenship, and then gender equity, and then nutrition, health and sanitation, prevention and management of substance misuse, which is a big problem here in Nagaland. And then another one is promotion of healthy lifestyle, which is really needed in this age. And then reproductive health and HIV prevention, as you have already mentioned. And then safety and security against violence and injuries. And lastly, the promotion of safe use of internet, gadgets and media.
These
which
are
is a
very important themes
important
here.
theme.
So you're saying these themes are to be imparted to the students by
the teacher,
the
school health and wellness ambassador. So something which is sensitive, when we say gender sensitive, maybe the female teacher can talk with the girls, and then the male teacher will talk with the males. That's how, like.
So how do they go about conducting the sessions in the schools?
At the school, this health and wellness teams, actually the school ambassadors, they're supposed to have this awareness talk at least 1 class per week.
1 class per week.
1 class per week. In all the classes, they're supposed to give 1 health talk in 1 class. And it should be done for 24 weeks, not counting the summer vacation, winter vacation or autumn breaks. So they have made it into 24 weeks. So at least for 24 weeks, at least once a week, they should have this health talk.
I'm just curious, do you get cooperation from all the schools?
It depends on the school, and it depends on the blocks also. As such, now in Nagaland, when we really started the school health and wellness program, we started in Kohima, Peren and Kifiri. So Kifiri was chosen because it was also an aspiration district, so we wanted to do something good in Kifiri district. So when it comes to it, yes, some of the districts are doing very well, and some of the districts, because we have some problem with this transfer and posting of the teachers also. Some of them, they are trained, but again they are transferred out to somewhere else. So we started with this 3 districts, and then we have PEC also, we have started from August, and now we are going to start in Mogokchung and Longling. So every year we're going to choose 1 or 2 districts, so that by the end of 3-4 years, all the schools should have this program.
All the schools in
the districts, in all the districts, in all.
Right now we don't have Dimapur.
We don't have Dimapur, except for these 5 districts that I've mentioned.
I see. But the plan is to extend and expand to all the districts in Nagaland. I see. So the 11 thematic curriculum that you have mentioned, those are very important, lessons that children must learn. I'm concerned about the mental health concerns, How is this mental health integrated into the school health and wellness program?
Because mental health is also one of the team. So the teachers are trained properly, and then they are trained to identify any students suffering from stress, anxiety or depression, especially depression. So these sessions are conducted on this coping mechanism, and then stress management, and then the importance of emotional well-being. All those sessions are conducted. And sometimes the teachers, we also request the teachers to do one-to-one counseling also,
Oh.
especially like it's sometimes people don't want to talk about mental health or if
Yes.
you are in depression, so we request the teachers to have this one-to-one counseling
I see.
session.
I've worked hugely on the sexual reproductive health, and how do you address sexual reproductive health matters or issues at schools?
Okay, teachers are also trained under age-appropriate materials. That means we cover the whole adolescent 10 years to 19 years. So some things we cannot talk with 10 or 11 years old. So they are given the appropriate materials, which to talk with the younger ones, or younger students, and to talk about it with the older ones. So in such, they are told to talk about puberty. As such, all the adolescents, they undergo puberty.
Yes.
And then the reproductive health, and then safe practices, safe sex practices. As such, nowadays we really have to talk about the safe practices.
Yes.
And then the gender sensitivity. So when we talk about gender sensitivity, that's why only we have made sure that there's separate male teacher and female teacher to talk about the sensitive issues also.
See, the next question frame is, are there any unique features of the program specific to Nagaland?
Okay,
I
in
have so many
Nagaland-
questions in my head when I'm putting that question.
Because
Yes.
in Nagaland also, okay, in some other state also it's there, but in Nagaland we have this developmental partners who come and which our state where we cannot do it or where we don't have enough fund, this developmental partners come in. So in this school health and wellness program, there was contextualization of IEC materials and posters, so relevant to Nagaland state. So it was incorporation of the cultural nuances and local knowledge and messages according to our Naga people.
Yes, yes.
So even the IEC material as such, the ministry, they give us some set of IEC materials, but when we see the pictures and the messages and all, we see that it's all mainland Indian pictures. So as it is, we are a little bit different. So they have helped UNAID, JAPICO, that is a John Hopkins.
Yes.
Yeah, they are the ones who have come and they have developed this IC material, almost the same, but the pictures and the messages as according to our needs. They have developed it.
Acha, acha. So when asking that one, moving, back to the previous question, we talked about sexual reproductive health.
Yeah.
Were there any concerns from the implementing agency, that would be department, with regard to the outlook of Naga society when we use the word sexual reproductive health? Are you going to talk these things to the young people? Any thought process went through on this?
Yes, there are some teachers who are raising this issue because I think they are having some problem regarding this also. But we say that this is something which we need to speak because in Nagaland even HIV is like prevalence is quite high.
Very high.
STI is also reported in Nagaland, so we have to make the student understand, and they should also be brave enough. So we also, when we choose the ambassadors, we request the school education to choose those who are self-motivated, those who have good communication skills, and we actually request them, like if the teachers can be below 45 years of age, so that way, like the students can approach them more, and we also choose those ambassadors who are more approachable.
I think here the audience need to understand is that when Naga society is exposed to internet, we get everything, and you have one of the themes
one
there
of
also.
the themes, the safe
So
use.
our children, every one of us, whether you are in the most remotest corner of Nagaland or in advanced places like Dimapur or Kohima, everybody is getting the same access of internet, and choices depends on the people who are surfing the net. So this is also the time we should be, able to come out as a society and seriously start talking about sexual reproductive health, so that without having cynicism, and be able to talk about it so that our children are able to, shift from children to adulthood responsibly. And this is a very good program which is going on, and I believe all parents in the schools and even the other stakeholders must be willing to support and cooperate with this program. Moving further on, Doctor, so what challenges has Nagaland faced in implementing school health and wellness program? Of course, we have discussed few challenges of our, what I don't want to use words so randomly, but of our, conservative nature when it comes to open space.
Yeah.
So, but any other challenges that you have come across?
Yeah, let me just repeat once again, because this is a real challenge. Cultural barriers and stigma associated with it, discussing topics like mental health and the reproductive system. That is, anyways, sexual health and sexuality. This is something even we as a health provider also sometimes with the children, it's a bit difficult for us to talk about it. And now why I'm also emphasizing this again, because in Nagaland there's now lots of teenage pregnancies also. Because we thought that in Nagaland we will not be having this teenage pregnancy, but when we studied the whole country as a whole, like teenage pregnancy was also reported. And when we checked in our HMIs, that is the Health Management Information System, we found out that the teenage pregnancy is really present also. So this is a real concern, because when a teenager, maybe as soon as 14, 15 years and all, they get pregnant, like how will they continue their studies?
Yes.
How will they manage their family? And also their health will really go down.
Yeah.
So, okay, like I don't want to speak like this, but especially in the outposts, we really need to talk about this.
Oh yeah, definitely. I mean, I traveled the length and breadth of Nagaland on my motorcycles, and so what I have seen, this is not a survey or anything, but I've been interacting with people. There is early marriage happening, and these early marriages are not, arranged marriages. So those are issues that we have to keep in mind. Like I said, we are being exposed to the internet. Internet is freely available. People are surfing anywhere, anytime they want. And because of our culture that we are in and the advancement that that is in the Western world is different, we forget many things and we try to imitate. And that way we go wrong. This is why very important we have to talk about these all very important 11 themes in the curriculum, and it should be supported by each and every one. And yes, mental health. If a person goes to a counselor, we have a tendency to dimag thik na husinegi na olop dimag la problem asinegi, and that is such a stigma that we all want to avoid. But I send my children from the young age till teenage. I've been sending them regularly every year to the clinical psychologists to study them, review them, so that they can give me feedbacks and help me to become a better father, better mother, better parents. So that awareness I have, and so I am able to do that one. But there is a general tendency, oh, tahan tala tadijon la bacha han tu olop thik nai du gane psychologist lo jaise na. I think we really have to overcome this way of thinking. Going to a counselor, going to a psychiatrist, it is very important for our own well-being, not because we are pagla or mentally olop 99 itu noy. It's very important. We'll have to go and understand. All parents must make good use of the professional counselors and psychiatrists. That's very important. And I can sympathize that you're having to go through that difficulty, but I'm sure we will overcome that as well. But as you know, as implementing the project or the work, you must have found some ways to overcome the challenges that we face here in Nagaland. So would you like to share all those things?
Okay, another challenge is we have under the school health and wellness program, there is a WEAVES program also, which is the weekly iron folic acid supplementation. As you know that anemia is also a problem in among the adolescents, right? And especially with the growth spurt that these adolescents undergo, if they don't have proper nutrition, that means they usually suffer from anemia. It might not be severe, but like mild anemia and all are there. So we have this weekly iron supplementation program where the government of India is the one which supplies this iron folic acid tablets. So for ages, there's age-wise they give the tablet, and weekly the teachers, the school health and wellness ambassadors, they are the ones who are supposed to give this tablet to the students. So there's some problem taking this tablet among the students as well as the parents also. They are quite apprehensive. But what we are requesting is, especially we had coordination meeting with the school education department also, and we have decided that we'll request that the teachers, they give this iron folic acid after the midday meal. Because this midday meal is supposed to be given in the school also every day. So since this iron folic acid tablet is given once a week, we request that the teachers, they give this iron tablet as soon as they have this midday meal. So that is what we are planning to do. We have had a series of meetings with the school education department, and now we are trying to motivate the teachers also. Some of the teachers are quite apprehensive that without the medical department, we don't want to give. But I think this is just a supplement. This is not for treatment. This is just a supplement because nowadays in a growing stage, we really require nutrition, especially the adolescents. So during this time, to supplement, to ensure that these people, they don't fall sick or they don't suffer from anemia. It is just a supplement. It's given in microgram. So there's no chance of any other side effect
of course
happening.
side effect
Iko side effect na thakibo. So it's just a supplement, not unhealthy. Kina wena healthy thakibo. To itula program ase.
You just mentioned about the midday meal, and that made me realize the nutrition and hygiene issues in schools. How do you address that?
So now, I mean, regarding this midday meal, I can't say anything, but we hope that it's
as
given.
part of the Ayushman Bharat school health program.
In that,
you have given anemia.
Yeah.
What
for
else?
anemia, and then we have this
iron folic.
Yeah,
that is
anemia
iron
means iron folic acid. This is a weekly iron folic acid supplementation program. That is what we do. Another one is RBSK, Rashtriya Bal Suraksha Karyakram. So in this, there's a school health and wellness health team. School health team, just a mobile school health team, which is there in all the 11 districts, those all 11 districts.
Achha.
So previously we had only 11 districts, and this RBSK program started more than 10 years back when we had only 11 districts. So in all these 11 districts we have this mobile health team, which is known as the RBSK team. There's the doctor, the nurses, the coordinators, and also
so the team is set, mobile team is medical mobile team is set to go to the schools
and the Anganwadi centers. So this also comes under the school health and wellness program. So what does RBSK, as per the guidelines, says, this RBSK team, they are supposed to go to every school in the district, in their particular district, at least once a year, and they should visit the Anganwadi centers at least twice in a year.
I see.
Because they have to travel the whole of the district. It's not possible to visit twice. So in this way, there are some 30 diseases that has been identified.
I see.
So this RBSK team, they go and screen the students regarding all this. And if they find that they have some illness,
then
so they refer it to the higher centers. So this is how they do.
It's basically the government has everything in place for our young people, the adolescents, in the school health and wellness program. And all we have to do is that you and I, as parents, we must be able to take good care, cooperate and support these programs so that you and I become aware at the same time as well, and support and cooperate with these programs so that it is a success, and so that our children, our young people, remain and grow up healthy and strong, become better citizens, responsible citizens. So there's so many things that we want to discuss further, but one last question. Very briefly, what are your future plans to improve and expand?
Okay. Since we are working in coordination with the school education department, they were at a loss on how to implement this program in a good way. So now they have come up with this school health card, which every student should be maintaining. So during this Teachers' Day this year, 5th September, our advisor, school education, Dr. Kyume, he is the one who launched the school health card. So this was based on this WHO expert committee, who said that to learn effectively, children need help. So they want children to be healthy, because even in our state also, the children, there's lots of dropout children, and many miss school and they don't learn properly because of ill health. So in order to avoid all these things, the school education department have come up with the school health card, which from next school year onwards, every student should be having. So in this place, what we have decided is our BSK team can visit only one school in 1 year. So what we have decided is whichever school is based in, and wherever health units are there, the health units from that particular village or town will go to that school and do the health checkup. So in this health card, they have this testing of hemoglobin, and then height and weight, BMI, all these things are there. So they'll be filled up, and also even blood grouping, everything. So the school, so if there's any problem, the teacher will identify it and they will refer the children to the higher centers.
I think that's a wonderful initiative by the government of Nagaland, and we wish you all the best and success in continuing with your Ayushman Bharat School Health Program. And thanks for coming to the studio and talking to us, giving us all the information that we have not been aware. And I'm sure all the viewers have benefited as well. Thank you so much.
Thank you.
Well, that's all we have this program of Top Form to talk, where we talked about school health programs, and we wish that you would continue to support and continue to watch Top Form DD Nagaland. Until then, bye.